Hi, this is Health Advocates Ask the Expert series, a monthly show about trending topics in healthcare. I'm your host, Courtney Preiser. In today's episode, we welcome back Dr. Raffi Terzian, Health Advocates Senior Medical Director, to discuss opioids and the impact of prescription misuse and abuse in the workplace. This is a timely and important issue that is affecting an increasing number of organizations nationwide. Thank you so much for being here.
Thanks for having me.
To set the stage, how big of a problem is opioid use in the workplace?
This is a significant problem to employers, but again, it has to be understood in the context of a larger societal problem. Opioid abuse has become a critical public health problem across the United States. There are billions of dollars spent each year in costs related to opioid abuse. 115 people or more die every day from an overdose. So prescription use and misuse and abuse is actually of particular concern when we talk about opioid issues. And prescription opioid abuse comes in the form of someone taking either a medication in a manner in which it wasn't intended, taking too much of the medication, or taking someone else's medication.
So how can employers then identify somebody who may have an issue?
First thing to understand is that this really should be viewed through the lens of addiction, and addiction is not a moral failure.
Right.
It is a brain disease. So recognition of that, I think, is an important first step. There are some telltale signs around folks who are misusing opioids, things like decreased focus and concentration. They may be sweaty, their mental status may be impaired,
Right.
Feeling shaky, that kind of thing.
Some definite things to kind of keep an eye out
From
for.
a physical standpoint. So there's physical and behavioral types of things to be concerned about that are red flags for employers.
So what is the impact of this epidemic for employers?
Well, there are significant impacts in terms of costs, both indirect and direct costs, in terms of productivity and overall healthcare spending. There's one analysis that found that the cost of treating addiction for health plans has increased eightfold since 2004. And it has to be looked at, too, from the standpoint of safety and understand there's a safety risk for both that person and for the persons they work with. In certain industries, for example, like manufacturing, or someone who's working around heavy machinery, or in the transportation industry, you can imagine the safety risk that poses. So other surveys, employer-based surveys, have found that while employers are aware of the issue, very few have a program in place to actually try to address the problem. So employers understand this is an issue. What they're looking for is help in trying to navigate through this and address the problem proactively.
So you mentioned that kind of where to start. So what are some best practices that organizations can put in place to help address this issue?
So some of the best practices include looking at their benefit design. And that would include looking at pharmacy benefit design specifically, coverage for opioids under a plan, what the formulary might look like, that kind of thing. Also, building in more opportunities to cover treatment for pain management, alternative treatments, for instance. So those are important from a benefit design standpoint.
Right.
From a practical standpoint, creating training opportunities to help management specifically understand the issue, how to address the issue, and then putting programs and policies in place to support employees. So those are all features of ways that that employers can be proactive. There are also broader policy initiatives in place. The CDC guideline for providers who prescribe opioids is helpful. And many states have prescription drug monitoring programs in place to help with tracking controlled substances. So both on an employer level and on a broader level, they're sort of taking a multi-pronged approach to trying to address the problem.
Definitely a community kind of broad, connected initiative to really address this large issue.
That's right.
Yeah. So how does Health Advocate help organizations and their employees who are facing an opioid addiction?
Sure. So the Employee Assistance Program is one of the key resources to be able to do that, both through support to the employer as well as the employee. And again, recognize that companies have moved away from zero tolerance policy to one of wanting to work proactively to assist employees and make an investment in their well-being and trying to get them back to work as soon as they can.
Makes sense.
At Health Advocate also, we have a robust clinical staff who could assist with all matter of healthcare related questions, specifically geared to prescription opioid use and abuse as well. So we're helping with things like care coordination, connecting the dots between all the providers that may be involved in someone's care, decision support to help with health information, understanding a condition better, and then finding providers, residential treatment facilities as an example for substance abuse, psychiatrists, therapists, etc. So we have all those pieces in place, and the goal is really to take a holistic well-being approach to the employee.
And to kind of reduce the burden for the caregiver, whomever is helping the person
That's
affected.
That's right, because it's not only the employee who's going through this, but a family member or a caregiver who is impacted by this, and being able to provide resources for them and support for them is also important.
Great. Well, thank you so much. This is such an important topic. I really appreciate your insights.
Thank you.
And we hope you like what you just heard. You can subscribe to our channel below or follow us on our social media pages. And join us again next time for another edition of Ask the Expert.